Winter is approaching quickly, and just like you need to make sure your car is tuned up, you also need to make sure your heart is ready. Did you know that Americans are at 30% greater risk of death from heart attacks during the winter months? Here now to explain the impact of heart disease in our communities and also share recently approved stent technology to help prevent heart-related emergencies is Dr. Alpesh Shah. Thank you for joining me today, Doctor.
Thank you for having me. My pleasure.
Now, first, Doctor, we know heart disease is a problem in the United States, but how big of a problem is it?
Yes, heart disease is a very significant problem. We have about 15 million Americans who have heart disease, who are diagnosed with heart disease. That almost amounts to 700,000 heart attacks every year. And what is really important to know is that 20% of those heart attacks are fatal. Heart disease, which includes strokes and heart attacks, is the #1 cause of death in US. It affects more women than it affects men. More women die from heart disease. It is a significant problem. It adds to a lot of economic burden on our society. More than $300 billion are utilized every year for heart-related ailments, whether it is from the treatment part of it or whether it is because of indirect costs such as lost wages.
Oh, wow, that's astonishing. Now, like you said, Americans are approximately 30% at greater risk of death from heart attacks during the winter months. What are some of the most important findings surrounding heart emergencies during this time of year?
Well, I'm really glad you pointed that out because there is definite increase in heart disease and heart-related events such as heart attacks during winter months. We have been observing this for the last decade or two every winter, especially during the window of December 25th to January 7th. We have, as you said, 30% increase in heart attacks. Believe it or not, December 25th is the day when you have the most amount of heart attack and heart attack-related deaths. Second highest is December 26th, and third highest is January 1st. We have to be more vigilant. There are varieties of reasons. I mean, there are several theories as to what increases heart attacks during winter months. One of the thought is that maybe during the winter months, we require more oxygen. The heart has a lot more workload to maintain the body heat. Or maybe it is susceptible to inflammations and infections such as flu. Maybe there are certain hormonal imbalances. There's also this phenomenon of vasoconstriction. Maybe the blood vessels narrow. And this all will predispose to a heart attack.
That's very good information to know. And what are some of the most common devices used to treat coronary artery disease?
So coronary artery disease basically means blockage or plaque buildup in one of our arteries which supply blood and oxygen to the heart muscles. This is basically nothing but cholesterol and fat deposit inside those arteries which narrows the blood vessel. There are varieties of ways we can treat it. I mean, obviously some blockages can be fixed with medications. Some blockages, if they are very severe and many in numbers, require bypass surgery. But what is really exciting is the technology of stent. A stent is a metallic mesh, a little tube cylinder, which is delivered over a wire through a catheter into the coronary artery, and that opens up the blockage. It allows for oxygen and the blood flow to be restored to the heart muscle. It often leads to stopping a heart attack, and in some cases even preventing heart attacks and making a person feel better in terms of less chest pains and less shortness of breath. So it is a very, very interesting technology. The current stents we have, as of today, or as of a few months back, required a polymer. A polymer is basically a part of the stent, which is a layer which allows the drug molecules to attach them. The drug is very important. It prevents scarring or re-narrowing of those blood vessels. But again, the polymer was also becoming a problem. So very recently, just for last month or so, we have FDA approval on this very new technology, which is made by Boston Scientific. It's called Synergy. It's a new type of a stent, and it holds a lot of promise.
Wow. Now, you mentioned how it's done. Now, how safe is this new technology, and how is it helping to save lives?
So what this technology of Synergy does, it actually makes the polymer go away. So as I said earlier, the polymer is a source of inflammation. Polymer is basically an unnecessary part of the stent, which is required to get the drug delivered, but after that it becomes unnecessary. That's where you can have future heart attacks. It can sometimes lead to inflammation and chronic re-narrowing of those blood vessels. So a lot of our patients who do really well for the first year, unfortunately, they keep on coming back at about 2% every year rate after that. And that's very unfortunate. But what this stent Synergy does is basically gets rid of the polymer. At 3 or 4 months, it bioabsorbs, it biodegrades. So there is no polymer attached to that stent, and that allows that stent to heal. And that is very unique. This is the first time in the US we have such a stent technology available. I really believe this holds a lot of promise in vascular healing. It should allow those arteries to heal long term, will definitely allow our patients not to have recurrent heart attacks or a repeat narrowing of those blood vessels.
And that is wonderful new technology. And what are some ways that people can stay heart healthy this winter season?
Yeah, I mean, remember, it is not just about medications and stents and technology. I think we all have to be very responsible for our heart health. The first thing is awareness. I mean, we must ask ourselves, what are our risk factors? Hypertension, diabetes, high cholesterol, smoking history, family history of heart disease, poor dietary habits, lack of exercise, excess weight. These are all the risk factors identified by American Heart Association. Once you're aware of those risk factors, go and talk to your family doctor. Go and seek a cardiology consultation. Maybe do a stress test. Maybe even do an angiogram if necessary. And that's when we can take advantage of this new knowledge, this new technology of stents, and especially with stents like Synergy, we really can help those patients heal their arteries. And by the way, we can get more information on this going to their website, which is bostonscientific.com/synergy-us.
Great, thank you so much for that. And for more information on the new stent technology, as well as on tips on how to stay heart healthy this winter, visit www.bostonscientific.com/synergy-us. Thank you so much. It's been a pleasure, Dr. Shah.
It's my pleasure as well. Thank you very much for having me.